Hello and welcome to Bullshot Show. Tonight we have Dr. White. Dr. White, welcome to Delmar TV.
Good evening. How are you? How's it going?
It's going good. It's going good. There has been a lot of medications that has is popping up, a lot of names, but one medication that stand out is ivermectin. Please explain what ivermectin is and what was the original purpose of it.
So yes, very good question, and very important question too about this ivermectin. One of the when ivermectin was first brought on the scene in 1975, and the doctor that put this medication together got a Nobel Peace Prize for it. It was indicated for parasitic infections, mites, scabies, worms. People have, from different tropical kinds of illnesses. And so it's used by the FDA. It's for parasitic infections. Um, Now, what happened back in March of 2020? So March of 2020, some scientists, uh, because ivermectin has also been looked at with other viruses. They started looking at ivermectin with COVID-19. And there's a study, and for anybody that wants to look for the study, you can look up the original study that was done with ivermectin and COVID-19 in vitro. In vitro meaning in the lab. Well, when they put the ivermectin with COVID-19, a SARS-2 coronavirus, within 48 hours, 99% of the virus was dead, gone. And
99.
99% of the virus dead. And this was, so again, this was in vitro, this was in the lab. And of course, you know, remember how people were dying, and we
Yeah.
couldn't find the ventilators and places to put people, and to bury people. So when they came across the fact that in vitro the ivermectin was killing 99% of the virus, they started doing in vivo, which is human clinical trials. And of course, during that time, it's hard to run a standard clinical trial in the face of a pandemic. So a lot of people, a lot of scientists, a lot of doctors were doing doing what's called retrospective studies. They were looking at patients that took ivermectin, and let's say if you had 100 patients and you gave 50 of the patients ivermectin, the other 50 did not have ivermectin, and they were seeing that the patients that got the ivermectin did very well. They did well in terms of death, in terms of recovering, days in the hospital. In all areas, they were doing very well. And so that in itself, now when we're looking at how ivermectin was, um, how people were actually getting better or not getting better, and we saw that they were getting better. Um, but the trials were little. The amounts of people that they were looking at were small, and so there was a number of studies that were done, and they presented ivermectin as a potential um, medication for COVID-19. They presented it to NIH back in August of 2020, and at that time, the NIH said we're not going to be using ivermectin. We're not going to use it. turned it down. And so a lot of the doctors that were very excited and thought that it was a good choice of treatment started really trying to do the clinical double-blinded randomized controlled clinical trials. But again, it was difficult to do that because we're in the middle of a pandemic. To run a good, strong, solid double-blinded controlled placebo clinical trial, you got to have all those pieces. And at the time, and still, where people are wearing masks, you have to practice social distancing. All of these things were going on. However, they managed a group of physicians managed to do clinical trials. They managed to get some clinical trials done. They weren't robust trials where you had 3,000, 4,000 patients, but the trials were done, and they did show some compelling evidence regarding ivermectin. In other words, they saw that it was working. And so they presented it, fast forward, they presented it again between August and December. A lot of the studies were done and trials and were done. And they found, they presented it to the NIH in February, and the NIH said, we're not going to say that you can. We're not for, we're not against. We're not for, we're not against, which really was to people that were ivermectin proponents. That was good news because the NIH had initially said we're against the use of ivermectin with COVID-19. And now in February, they said, last month, they said, we're not for, we're not against. And so now you have people that are actually using ivermectin for prevention of COVID-19, for treatment, and for the long COVID or the long haulers. These are people that have been infected by COVID-19 and have residual symptoms: cough, shortness of breath, muscle ache, brain fog, uh, just not able to be real clear about their thinking, palpitations, heart, uh, and just a host of different symptoms that people have. And I'm not talking about just a little bit, I'm talking about like significantly. Can't do much without getting very fatigued. Um, and I would really encourage the people that are listening to look, go to, look up long haulers, look that up on the internet and see what's going on with that, because you're going to hear a lot more about that. And so, getting back to ivermectin, what they have found is that ivermectin is has good results when you look at it in terms of treatment, prevention, and this long haulers syndrome. And so I think that one of the things that I think people need to do is to talk to their family physician about ivermectin, get their opinion about it. Uh, 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 have your doctor look up ivermectin and have a conversation about the appropriate use for that medication, because we have the vaccine, and we're trying to get everybody vaccinated. We've talked about a herd immunity. We want people to be immune. We want people to be protected. The other thing that we have to think about is how long how long how long do these antibodies that are going to be produced? How long do those antibodies last? I mean, we know there's a expiration date. There's a time that those antibodies are going to go down. I mean, every year we get vaccinated with the flu vaccine. That comes up every year. When will it come up for this COVID-19?
A quick question. Your original description of ivermectin is anti-parasite. And since it's been discovered that ivermectin is killing of COVID-19 99%, let's say, for instance, hypothetically speaking, that I didn't take the shot and I have hesitation about the shot. Do I need to take the shot in order that ivermectin to be effective?
So you're saying you're saying the question is, do you need to take the vaccine in order for ivermectin to be effective?
Right.
Okay, so it's a good question because it allows me to be clear about ivermectin and the vaccine are totally different treatments.
There you go.
Those are two totally different treatments, and so if we get to a point that we get these mutations and variants that are arising. I was reading the paper yesterday, and New York has another variant that came up. And so the vaccines have been made specifically for a specific mutation or a specific strain or specific variant. So if it changes, if the virus changes, just like the flu vaccine, it changes every year. So we have to have another vaccine. We don't have the vaccine from last year because it changed. That's what viruses do. They mutate, they replicate, they change. And so the problem with COVID-19, as we have seen, it was a pretty intense and a pretty hardcore virus. I mean, a lot of people died, behind infections with COVID-19. And so I think that we have to keep up with, the treatments. Will it be a vaccine? Will ivermectin somehow will ivermectin turn out to be a treatment for COVID-19 to prevent you from getting COVID-19? So I think that we need to be aware of ivermectin. I mean, I think to not be aware of what's going on and the treatments is not good. I mean, we've heard of I don't know if we've heard monoclonal antibodies. We've heard of convalescent plasma. We've heard of antivirals. We've heard of steroid use, and so I think that we've got to keep our eye on the ball of what's really where is the cutting edge things? What is the rest of the world using? If you look up ivermectin in Peru and look at the uh, the value that ivermectin had in Peru, significant. Uh, the death rate went down significantly, and all the Peru you can kind of think of as having states, like we have different states in the United States, and so they did they started giving out ivermectin to everybody, and you just saw a drop in the death rate and the hospitalizations and people getting sick. So we have to take a look at this, and I think that in order for us to be look at all of our options and ask our physicians, is it reasonable for me to even be thinking about ivermectin? Um, and if you look at the clinical research, um, uh, you can see that there's been a lot mountains of clinical trials, clinical studies, I will say, on ivermectin, and a lot of good outcomes with it.
Speaking of steroid, you see but the medication prednisone, and you might see a patient who actually take it a month after they had COVID, who have muscle cramps, inflammation. Can you talk about that a little bit more?
Right. So prednisone is one of the is a medicine I think that people really a lot of people when you talk about steroids, a lot of people have a lot of if you're not in medicine and you don't really know the specifics about steroids, most people kind of shy away back when you talk about steroids. Um, the reason why people use steroids, like you said, 2 weeks, 4 weeks, a month, 2 months after the infection, is because the steroids can uh, shut down the cause of the muscle pain is your immune system is still reacting. Your immune cells are still uh, in a cytokine storm. They're still going through the storm, um, and we don't know why. We don't know why people that get infected with COVID-19 um, continue to have. We talked about the mast cell. There's tons of other inflammatory cells and pro-inflammatory cells that are just continue to be stirred up. So what the steroids do is they have a tendency. Steroids are probably one of the strongest anti-inflammatory. In other words, shutting down inflammation. Um, so people will take one of the treatments right alongside of ivermectin. One of the treatments that people are using around the world uh, are steroids because they truly shut down that immune system. And so when you shut down the immune system, you quiet things down. So you go from a cytokine storm to a quietness. And so now you don't have these cells and this inflammation of the muscle, inflammation of the chest, uh, inflammation of the brain. The brain, you've heard of people having brain fog and
Right.
can't think clearly. You don't have any of that once you shut down because it's once you get to that point when you're a month out, 2 months out, it's not the virus now. The virus is gone. The virus came in, destroyed the cells, and created a storm. And now your immune system, your body's immune system, is now trying to regroup, if you will. Well, some 20 to 30% of the people's body's immune systems can't regroup back down to baseline. And so they're stuck in a hyperimmune state. And so you have medications like the steroids where you can give them what's called a pulse treatment where they may get it for 2 weeks, things quiet down. What we're seeing now is things quiet down and people get better. But then, after the steroid wears off, this immune system gets ramped back up. It's really unfortunate that, um, that this virus has caused this kind of problem with our immune. Now we got an immune system problem.
Hmm.
First it was an infection problem. The virus was attacking the cells. Now we're talking a month out, 2 months out. We're talking about an immune system, your immune system. That's why, remember we talked about vitamin D, vitamin C, quercetin, melatonin. All of those vitamins are uh, working with your immune system to strengthen your immune system, and that's why there's been so much talk about vitamin D. Vitamin D is a very um, big player when you talk about immune systems, and all the other uh, vitamins that we've talked about, because we're talking about an immune problem after the virus leaves. So that's the one thing that I want our community to know. And I think that a lot of times in our community, and I'm talking about our African American community, people of color,
Hmm.
Somali, we're kind of in a situation where we don't get the news, we don't get the base broken down, break it down kind of information. I mean, if you're not into medicine and you're not a scientist or you're not in biology or whatever, who's going to understand about a cytokine storm and steroids and ivermectin and stuff like that? And this is why I think, this program, excuse me, even though people might not understand clearly, they may not have a clear understanding of what I'm saying, but just the fact that they've heard about ivermectin, and if they hear about it again, and it gets to be a big issue, they can always come back to you and say, hey, Dr. White, we talked about ivermectin. We need to talk about that some more.
Absolutely.
Yeah, we need to embrace that whole idea. What was he saying about that? So now it goes from no knowledge to some knowledge, and then you get more knowledge. So when people start talking about these different steroids and ivermectin and long haulers, and the immune system is ramped up and sort of those kinds of things, I think people will have a better understanding. The Bible talks about the Quran. I don't know if the Quran talks about it, but the Bible talks about uh, people will perish for a lack of understanding. For not
That's right.
we don't understand, and so we perish. We don't know about we talked about the vaccine. The vaccines are useful. They
That's
make
right.
and those antibodies can protect your body. Ivermectin, it's there. It's on the, you can look it up on the internet. It'll tell you about that in vitro study where 99% of the cells were dead after 48 hours.
Wow.
That's impressive. And you got to take a look at that. Um, Given the situation that we just went through over the last year. And so I think that, part of the part of the problem uh, in our culture is that we just don't have the information, and we got a lot of people are saying that. I've had patients ask me, what do I think about this vaccine, and they say, do you think it's a conspiracy? And I said, well, the one thing that you can know is that if it is a conspiracy, they're getting it too. They're giving it to themselves. They're taking
Common
the
sense.
sport, and they're not. The people aren't going to do that. There's too many people. Uh, there's too many eyes on the ball.
True.
And so and again, if this was something directed at people of color, it you know they would be saying, okay, only people of color take the the vaccine, but they're saying everybody needs to take this vaccine, and we don't want to be, if the last thing I'll say, I just uh, uh, we don't want to be. If you look at cardiovascular disease,
Yes.
we're we top out on that. If you look at diabetes, we top out on that. If you look at high blood pressure, we top out on that. If you look at cancer, we top out on that. Everything is we're at the we're
the bottom.
we're ahead of it. And so when the virus came along and they said, well, people of color, minorities are dying worse than anybody else. Why? What is the problem? Well, we were already dying. We were already dying. Our rate of death from all these different diseases was already high. So, I mean, so we gotta, I think, people, we gotta just, we gotta,
We'll get the word out.
yeah.
The word out. As always, Dr. White, we truly do thank you for your valuable time. Thank you very much for sharing valuable knowledge and giving an explanation of some of the questions that we always might have.
Absolutely. My pleasure.
Thank you.